Here are a few facts about asthma. There's some new asthma medicines out there called single maintenance reliever therapies or SMART therapies that are combinations of the two regular kinds of asthma medicines, inhaled corticosteroids and beta agonists. It used to be that we thought bronchospasm was the main part of asthma, and over the last few decades we realized that inflammation is taking a bigger role. These new medicines attack both parts and are going to make a big difference. There are also a group of medicines called the biologics, including Dupixent and Xolair, that are making a huge advance in the treatment of allergic asthma. Using an inhaler is difficult for anybody, especially in a crisis. So you should always use an inhaler with a spacer or valved holding chamber. If you're not sure how to use this, you could look it up on YouTube for valved holding chamber, and it'll help your child get the medicine to where it needs to go. It's important to know your child's triggers for asthma. For instance, in the Northeast United States, by the third week of school, everyone has a cold. So in that case, it would be a really good idea to start your maintenance medicine before that happens to limit the number of attacks your child has during this difficult time. Also, not all that wheezes is asthma. For instance, infants can get viral illnesses called bronchiolitis. Older people who have cardiac disease can have cardiac wheezing. There's a lot of different things that can wheeze, so don't just assume that your wheeze is secondary to asthma. The goal of treatment of asthma, besides living a full life, is to avoid oral steroids. Inhaled corticosteroids are good for controlling asthma, and in fact, they're 1,000 to 10,000 times a smaller dose. They're in micrograms rather than milligrams compared to oral steroids. Oral steroids can have very significant side effects, and we try to avoid them unless it's absolutely necessary. Now your child with asthma is coughing. How do you know when to use the rescue inhaler? So here's a couple little hints that I use for myself to pick up when that cough is actually wheezing. So first, if you have the child take a deep breath in, if they're wheezing, they're going to cough right after they take that deep breath. Also, if laughing or running around triggers that cough, most likely the inhaler will help them with that as well. And finally, if you ask the child where their cough hurts, most of the time when a child has a cold, they'll put their hand up near their throat to say it hurts there. If they have asthma, they'll put their hand over their entire chest to show that the pain is there. Finally, a good analogy for asthma is being ticklish. The way to think about asthma is a chronic illness with acute attacks. So someone always has asthma, they're just not always being triggered. So it's important to recognize to try to avoid those triggers to limit the number of attacks the person has.